welcome everyone to our CPPD QI conference, our annual conference. Really appreciate everyone attending today, and thank you for doing that. Sincere appreciation to our speakers for making the time today, and the conference planning team. Thank you for that. I will start off today by the land acknowledgement. We wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron, Wendat, and the Seneca, and most recently the Mississaugas of the Credit River. Today, this meeting place is home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. Thank you. And today's just a couple of housekeeping items. You know, there are chats, Q&As. You're welcome to write a question for every presentation. I'll be moderating those questions, and I'll try and curate them. Depending on time, sometime we'll try and get to a lot of the questions. If not, we will obviously find a way that you can connect with the speakers at a later time. And then evaluations, a link will be sent at the end of the day, and kindly complete the evaluation, and feedback is really important. Once again, my name is Dr. Raj Rasasingham. I am the CPPD Director for the Department of Psychiatry, and welcome to our conference. I'm going to now move it to our two conference chairs, who's going to give a little welcome. Thank you.
So good morning, everyone. And on behalf of the organizing committee, again, we want to welcome you to the 5th annual CPPD conference. I'm Dr. Karen Wang, and my co-chair this morning is Dr. Marlene Taube-Schiff, and we're both delighted to have all of you join us this morning as we explore the interrelated topics of measurement-based care and team-based learning. About a year ago, when we first actually start envisioning this conference, little did we anticipate how the idea of data-informed clinical decision-making would actually play out on the world stage. So not a day goes by where we're not being inundated with RT values, hospitalization rates, COVID positivity rates, and death counts. And it seems that public health policies are basically made and disbanded at lightning speed based on these calculations and curves. Edward Deming, the grandfather of quality improvement and the creator of the PDSA cycle, once wrote that in God we trust, all others must bring data. But how exactly has the use of data and measurement impacted the mental health field? Psychiatry has historically prided itself on the use of evocative language, and expression of psychiatric symptoms and documentation of progress is usually in the narrative format. Despite the introduction of measurement-based care for over 30 years now, we are only now as a field collectively becoming more accepting of the introduction of quantitative patient rating scales as a method of assessing symptoms and tracking treatment outcomes. Cataloging and quantifying the severity of symptoms still feels very foreign to many healthcare professionals. So our aim today is to showcase how measurements do not have to be a banal exercise in counting. In fact, measurement-based care can be a transformative undertaking that not only impacts patients, but also has direct effects on the provider's professional development, team performance, and also quality improvement for the larger healthcare system at large. I'm now going to pass the time to Marlene, who's going to introduce our speakers.
Thank you so much, Karen. Well, one thing I wanted to say, since being a part of the CPPD Planning Committee in different ways over the last few years, we've gone from different times of the year, different venues, to now virtual. So it's kind of interesting to see how this conference has been evolving and where it will continue to go. So we have really a wonderful lineup of speakers and panel discussions for all of you today. We're going to start off our morning with an experienced educator, mentor par excellence, and former Vice President of Education for the Center of Education and Mental Health, Dr. Ivan Silver, and Dr. David Walger will be introducing him shortly. We're then going to move to a panel presentation and discussion on the impact of measurement-based care in practice. We've really chosen to highlight clinical care examples in mental health where MBC has taken root. These initiatives, we hope, will really provide a realistic portrayal of the challenges and opportunities of utilizing data to be able to drive decision-making in patient care. Dr. Sanjeev Sokalingam, the current VP of Education at CAMH, will facilitate a post-panel conversation on how CPD and QI work and intersect together. Last but not least, we'll also have Dr. Brian Wang, who's the new the new director for the Center of Quality and Patient Safety, CQIPS. He will share some of his reflections on aligning quality improvement initiatives within a hospital's strategic direction. As we move beyond the borders of psychiatry into other areas of medicine, we hope you can join us in reflecting on how data and teams really work synergistically to bring about meaningful change. I also just wanted to take a few moments to review some Zoom etiquette, if you will, which I think that people are, for better or for worse, very familiar with the Zoom by now. But just some things for us to think about if people can mute yourself during presentations. There are differences between the gallery view and the speaker view. So if you're on gallery view, you can often see many, many people across your screen. Some people enjoy that. Some people find it kind of distracting and tiring over several hours. So if you switch to speaker view, you can really highlight the one individual that's talking. And as Raj was talking about, we'll have sort of a chat and a Q&A function that people can use throughout the day to have a little bit of interaction. If you find it exhausting or discouraging to see yourself all day, you can hide yourself with the hide self view and just focus on the other people that are talking. So I'm going to turn it over now to Dr. David Wilder to give us an introduction to Dr. Silver. Thank you so much for coming, everyone.